This yoga flow is specifically designed for anybody who is dealing with back pain. So my advice as you move through this yoga sequence, any sensation that you have that is a sharp shooting pain or a pinching pain, I advise you to back off. As long as it's below a 4 out of 10, we can kind of stay in that range. But if that sharp shooting pain starts to exceed above a 4 out of 10, then definitely back off and don't try to push past that point of motion if you are currently at that 3 or 4 out of 10. On the other hand, if you're experiencing a pulling sensation, it's okay to work through that. Again, we kind of want to avoid going above a 5 out of 10 in this scenario. Just listen to your body, do your best. Don't feel like you have to force anything. So let's get started. Lay on your back. It's going to be helpful if you have some yoga blocks as well for some of the positions where you're really tight. It just makes it more accessible. So when you're laying on your back, the most comfortable position, typically if you're dealing with low back pain, is to keep the knees bent. One hand on the chest, one hand on the belly, and let's get started with some diaphragmatic breathing. So what this means is we want to fill the bottom of our lungs first. So drawing air in through the nose, think about filling your stomach up with air. Your belly button is going to press into that bottom hand. And then as you exhale, that belly falls. Try to let go of any tension throughout the body. Relax your shoulders. Relax your jaw. If you feel like you're holding tension, just keeping the knees here, you can even just let them kind of flop in and rest on each other. Nice, slow, deep breaths to clear our mind. From here, take the right knee and hug it into your chest. We're going to start to make little half circles with this right knee, taking it out to the shoulder and then across the chest. Just working into that hip joint. If you'd like to straighten out this left leg and let it come all the way down to the mat, that's an option. But again, if you're pretty inflamed or irritated right now, you might find it more comfortable just to keep that knee slightly bent. And switch sides. Right foot down, draw the left knee in. Little circles in the hip, taking the knee back and forth. Switch back to the right side, and instead of placing your hands on top of the shin, interlace your fingertips and place it behind the thigh. Start to straighten out the knee, and when you feel pain or tension, back off and bend the knee. So we're not really doing anything with the ankle right now. We're just starting to increase blood flow to the hamstring, starting to loosen it up a little bit. After a few reps here, we are going to add in the ankle. So straighten the knee and then pull the toes back towards your nose. Point the toes and bend the knee. So in addition to moving the hamstring, we're also giving the nerve that runs from your lower back down the leg a little movement. So kind of freeing it up on anywhere that it's stuck or that's getting pressed on. Straighten the knee, toes towards your nose, point the toes, bend the knee. One more time. And switch sides. Right foot down, pull the left knee into your chest, interlace the fingertips behind the thigh. Just the knee to start, do what you can. And then when you're ready, add in the ankle. Straighten the knee, pull the toes back, point the toes, bend the knee. Last one. And both feet on the mat. Let's take the arms out to the side. You can separate the feet about hip distance and then let those knees just kind of fall to the right and then windshield wiper fall to the left. So a little bit of movement from both the hips and the lower back. Okay, stop in the center. Place the right ankle on the left knee. And then hug that knee into your chest. So a lot of times this stretch feels really good, and I'm throwing it in this flow for a purpose. If you really like this stretch and this foot can come all the way to your chest, I'm sorry to tell you, but you probably don't need this stretch, and these muscles aren't tight. So just a demo. Follow up with me at the very end, ask a question, leave a comment, and I can lead you to the right direction on how to strengthen these muscles, because if you like this, again, your knees all the way into your chest, you probably don't need it. But from here, let's take the arms out to the side, keep this figure 4 position, and let the legs fall to the right. So this right foot, it's a little anchor for the knee here. So we get a nice spinal twist. Bring it back to the center, switch sides, just a quick test. Do you like it? Do you not like it? This figure 4, again, if this feels amazing and you want to bring that foot all the way into your chest, you don't need it. You probably need strengthening. Leave me a comment. I will lead you in the right direction. Arms out to the side, let the legs fall to the left. All right, back to the center, hug both knees into your chest. And then any way you can, with the least amount of pain, bring it up to a seated position. If you want to rock it up, roll over to your side, and then flip it coming into tabletop. All right, shoulders over wrists, hips over knees. We're going to move through cat-cow. Again, remember those directions from the very beginning. If you feel a pinching pain, which is most common in this position, back off. If you feel a pulling pain, which is more common in this position, you can work through it. But again, just listen to your body. We want to stay below a 4 or 5 out of 10. All right, let's find a neutral spine. Sit the hips back to the heels. Take the arms forward, child's pose, forehead down to the mat. Allow your forehead to just rest here. Take a few more deep breaths. Shift forward back to tabletop, and now we're going to combine cat-cow with that child's pose in a dynamic movement. Round your back as much as you can. Stay in this position and sit your hips back to your heels, feeling a really nice stretch to the lower back. Shift forward, tabletop. Switch directions into that cow pose, so butt out, chest up, and then sit back. You might feel a little pinchy, back off. Squeeze your butt muscles, do your best. Push yourself back to tabletop. Round, coming into cat. Sit back, hips to heels. And we're just going to keep flowing through these transitions. Arch your back, butt out, chest up. Sit the hips back to your heels. Tighten up your butt, push forward. Round the back, chin to chest. Sit back, really good stretch here through the lower back. Let's do one more time, each variation. And on this last child's pose, let's stay here. Maybe take the knees a little bit wider so your chest can fit between the knees. Walk the hands forward, forehead to the mat. Pick up your chest and walk your hands over to the right. Feeling the left side of the body expand, opening up the space between the rib cage and the left hip. Switch sides, passing the center of your mat, take it over to the left. And back to the center, bring it up to tabletop. Thread the needle right side first, reach the right arm up. And then take that right arm behind the left. We're going to bring this right shoulder all the way down to the mat and stay here for a moment. So you want to try to get that right shoulder and the right side of your head touching the mat. A little uncomfortable, just breathe. Again, on this side, inhale, reach the right arm up. And then exhale, thread it through. Let's switch sides. Left arm up. This time your left shoulder and the left side of your head is going to come all the way down to the mat. One more time, reverse it. Reach the left arm up and thread it through. Back to tabletop. As we head into a downward facing dog variation, I want to make sure that you guys are set up in the right position. Hands underneath the shoulders and tuck your toes under. I want to revisit cat. So you want to go butt out, chest up. This position of your hips is really important for a solid downward facing dog and to stretch and move what the intention is. So from this position, lift your knees, keep the knees bent and send your hips high up towards the ceiling. We're not so worried about the hamstrings yet. We just want to get a nice straight line from the hands all the way up to the hips. Let's make this dynamic and move. Inhale, drop the knees just underneath the hips, touch the mat. Exhale, lift the hips back and up, keeping the knees bent, sticking that butt out. Inhale, drop the hips. Exhale, lift the hips. One more time. Inhale, drop the hips. Exhale, lift the hips. From here, let's straighten out the right leg and then switch to the left, alternating back and forth. If this is too much for you right now, you can just pause and take a break in child's pose. Drop both knees to the mat, and then we're going to lay down on our stomach. Elbows underneath the shoulders. Pull the shoulders away from the ears, so we're not all hunched down. Lift the chest, lift the chin, and just pause. So depending on what type of back pain you're having, this may feel really good. This extension position is typically favorable for anybody dealing with any type of disc herniation. However, we're all different. We all have different symptoms. So if this is painful, if it's giving you any symptoms down your leg, if it's giving you any type of pinching, sharp pain in your back, then just lay flat down on your stomach, like this. So actually, let's everybody come down here, hands underneath the shoulders, and we're just gonna do little baby cobras. Think about 50% effort coming from your back, 50% effort coming from your hands, and lift together. So not all the way up. You can see my stomach is barely coming off the mat. Just a little intro. If this feels okay, no pain, feel free to progress where we start to straighten out those elbows a little bit more. If this is already aggravating or irritating, stick with that really low range. Okay, last one. And let's reverse this position. Press yourself all the way back into child's pose. From your child's pose, come back into tabletop. Tuck the toes, lift the hips, downward facing dog. Quick transition. And then walk the hands back to your feet. Soften the knees a lot. Grab opposite elbows and hang heavy. Place the hands on the mat. Walk your feet all the way out as wide as your mat, and then drop those hips down in between your heels. So typically we want to hold some tension in this position where it's active. For the sake of just focusing on our low back pain right now, we can be passive. So let's lift those hips again, bend the knees a lot, hang heavy. Walk the hands out. Drop the knees down to the mat and child's pose. Child's pose is a very decompressive position for the spine. So feel free to stay here and breathe as long as you'd like. This is the end of the flow. Again, I encourage you to just stay here, relax, decompress. If you prefer lying down on your back, then flip it over. Take a few moments in Shavasana